All right, with this question, I know right away you're looking at this photo, and then please, some advice. With these photos on the USMLE, they're trying to get you to be nervous. They're trying to get you to panic. There is no book, there's no collection of photos the USMLE releases that tells us, okay, guys, this is all the photos we're going to use from this library of photos. In reality, they can choose any picture they want anywhere in the world. So for me, unless there's one or two lines in the scenario that simply says, this is the patient, what's in the photo, I never look at the photo at all until later. I typically look at the scenario itself from top to bottom. There's a lot of information just by looking at here that's going to allow us to read the scenario, extract all the pertinent findings, and then come up with an answer. And then if we have to look at the photo, by all means. So when photos come up, don't panic, don't get nervous, leave it alone. Use it if you really have to. So automatically read the last 2-3 lines. A photomicrograph of a Prussian blue stained bone marrow is shown. Which of the following is the MOA of the drug responsible for the patient's findings? Okay, so we don't know what's going on. We have to go to the top and read the scenario, like I always tell you to do, and go from there to see what the patient has. A 46-year-old man recently immigrated from Mexico comes to the physician for a pre-employment wellness examination. Tuberculin test is administered and develops a raised erythematous 12 millimeter lesion on his forearm within 48 hours. Okay. Chest x-ray shows no abnormalities. That's important. Started on recommended antibiotic treatment for latent TB. Okay, so they're telling us what he has. 4 weeks later, he returns for a follow-up examination. Hemoglobin concentration, 9.3, low. Serum alanine activity, 86. Serum aspartate activity, 66. So looking at labs here, when you start answering more questions, you feel more comfortable with the ranges. They're typically 38 to 40. Anything less than 40 is normal. So they're over 40, so I can say these are both elevated. They're not as elevated as thousands per se, but right now it's over 40. So it's high, okay? So we have anemia, 9.3, and we have high liver enzymes. Okay, so we know it's latent TB. This is where we have to use some content because unlike other types of topics and systems where there's many, many more drugs, TB has typically 4 to 5. We have rifampin, isoniazid, pyrazinamide, ethambutol, streptomycin, right? It's the RIPES regimen. We usually say RIPE, but there's an S for streptomycin. Now, being that's the case, there's only 5 MOAs, and there's numerous adverse effects for each drug, and that's what we have to know to do well in this exam. But being that we have some anemia, and being that there's liver enzymes are increased, we need to know that, and we need to start looking at the answer choices. So the first one is inhibition of dihydropteroate synthase. This, I know, is not involved in any of the RIPE regimen drugs that we talked about. So we knock this out. 50S. We did this in the previous, we mentioned this in a previous question about buy at 30, sell at 50. So maybe they're talking about macrolides here. And this is not related to, we don't give that for TB. Bacterial inhibition of bacterial RNA polymerase. Now, a little tip, rifampin, right, revs up to P450. Rifampin R has red-orange body fluids as an adverse effect. Rifampin inhibits bacterial RNA polymerase. Did you get me on that? Did you catch that? Meaning R. RNA polymerase inhibition revs up to P450, red-orange bodily fluids, right? So this is rifampin. Now, rifampin has some sort of hepatotoxicity, but it has nothing to do with anemia. It doesn't cause anemia. So remember, we can't take 1 or 2 findings that we like in the scenario, take it in and put that in the answer choice. No, we have to appreciate everything that they present with, and we have to understand and put it together and come up with a conclusion of the actual disease, drug, or condition that they're asking us. In this case, well, there is hepatotoxicity, there is some elevated liver enzymes, but does rifampin cause anemia? It does not. So this is out. Be careful. A lot of students hone in on a finding on a finding that they're familiar with, and they use that as the answer or connect the dots. But you have to use it all, not just 1 or 2 things. So we're down to 2. inhibition of mycolic acid synthesis. So we have the last one, inhibition of arabinoyltransferase. Now I have a friend in Brooklyn. He's an EMT. He's Arabic and drives an ambulance. So Arabic, arabinoyltransferase, ethambutol, ambulance, ethambutol. Now, side adverse effect to that, vision, color vision loss, issues with vision, right? So sometimes you might not remember everything, but if you start attaching certain information, you'll be able to remember that. So when I see a name like this, I'm thinking ethambutol. I know ethambutol has something wrong with the vision, some issues with color blindness or issues with vision. There's nothing here talking about vision. There's talking about anemia and issues with liver enzymes. So that's out. So by default, doctor, we have one left. This is the answer. It's that simple, but you need to know some of the information. And I can promise you, micro is challenging. Pharm is even more challenging. But if you can understand the basics and say, okay, there's only certain drugs that we give for TB patients. From those drugs, each drug has one MOA. From that one MOA, that drug has a couple of adverse effects. Now, nausea, vomiting, diarrhea, okay, we don't want any of that, but it's not as intense or crazy or so dangerous as vision loss or hepatotoxicity or other things that you can easily remember and stick and allow that to stand out versus the other drugs. So in this case, INH, isoniazid, the popular or the actual abbreviation for isoniazid is INH. Something to remember from first aid. I is injures, N is neurons, H is hepatocytes, injures neurons and hepatocytes. So they'll give you a question and either there's peripheral neuropathy or there's issues with liver enzymes as there are here, and the famous B6 deficiency to isoniazid. So typically when you prescribe isoniazid, you co-administer B6 to prevent B6 deficiency because then you would have optic neuropathy, sideroblastic anemia, and peripheral neuropathy. So this is important. I love to utilize this or test you this on the exam. So knowing the MOAs of these drugs and the adverse effects, obviously, allowed us to answer this kind of question because they either will give you the MOA and they'll ask us the adverse effect. They would either give us the adverse effect and they ask us the MOA, or they just want to, or they give us both and they want us to name the drug. In this case, it's isoniazid. I want you to go through the other ones, and as you watch more of my videos of answering more questions, please, and you'll see this yourself, please take the time to look at every other answer, because for me, I believe and I know that when you answer one question, you have 5 answer choices. Take a few moments and look at A and B and C and E, and you'll appreciate more the medications, the adverse effects, and the MOAs. So as you move down the line and answering more questions, you're building your foundation. So you're not going 1 for 1, you're going 5 for 1. You walk in with one case, coming out with 5 answers. And I promise you might think it's wasting time, but later down the line, you'll start seeing exponential growth in all your content and the information that you're reading. So points of entry, in this case, they give you lab values, so you know that this is something going on with the body. Anemia versus liver enzymes are increased. They present the case, you know it's TB. Forget about the photo. If you want to get it, fine. Look at it, understand it, memorize it. If you knew it was basophilic granules, congratulations. In this case, main concern is knowing the MOAs of those drugs allows us to knock out most of this information. Knowing the adverse effects linked to the drugs would allow us to then look at the information, say, well, out of everything here, there's only one drug that can cause anemia, sideroblastic anemia, and also hepatotoxicity. It's isoniazid. Look for mycolic acid synthesis, and there you go. So please study, review those MOAs, and review those adverse effects. I'll see you on the next question.